Hello, this is Dr. Lund, your Roseville neck and back pain relief chiropractor. Top 2 exercises for a pinched nerve in the lower back. So a nerve in the lower back can be pinched from a herniated disc or from something that's called piriformis syndrome, or be basically pinched from the piriformis muscle. And this may cause one of 3 things. So there could be pain only in the lower back and in the pelvis. It could cause pain in the lower back, the pelvis, and cause you to experience leg pain and sciatica. And then the third thing that can occur is you may only experience leg pain and sciatica without any lower back or pelvic pain. So let's talk about both the piriformis muscle and then the herniated disc. So the piriformis muscle is a muscle that's in your butt and it goes over the sciatic nerve. So if this becomes very tight, what it can do is come down over that sciatic nerve, irritate it, and then cause lower back pain and potentially sciatica. And so there's a way that we can assess if the piriformis muscle is contributing to your lower back pain or your sciatica. And so what I want you to do is let's say that you have symptoms on your right side. You have lower back pain, you have pain that's going into the right leg. How we assess this is the first thing I want you to do is take your left leg and basically we're just gonna cross it over. We're gonna put our foot, just above where our knee would be, and then we're gonna just let that sit there. And what we're noting is we wanna look at the level of where this knee is. Is it up high? Is it fairly parallel? You can kind of push on it and see how loose it is, okay? So we assess the side that doesn't have pain, and then we're gonna do the side that does have pain. So if you have right-sided pain, you're gonna do the same thing, assess. Now, this is pretty symmetrical. If it is about the same from side to side, then you're very confident that the piriformis muscle is not what is causing your lower back pain and sciatica. If the right side is the side you're having symptoms on and you go up here and like, oh wow, this is really, really tight, I can feel it pull here, you come up and this leg is substantially higher compared to the side that doesn't have pain, then we get very confident that the piriformis muscle is tight, and that could be causing your lower back pain and your sciatica. So if it is a piriformis syndrome, after you do the assessment, here's the stretch that you can do. So you're gonna lay down, and we're gonna do the same thing. We're gonna cross our right leg over so that our foot is above our knee. We're gonna grab behind our thigh, and the more that we sit up and the more we kind of pull our thigh towards us, we're going to feel a stretch here, which is going to be stretching that piriformis muscle. And so when you do that stretch, we just want to do it on the side that's tight. We don't want to stretch the left side because that side isn't tight. So we're just going to stretch the right side, hold it for 20 seconds, and then you would repeat that several times per day. And if it is a piriformis syndrome, when we stretch and we relax or loosen that tight piriformis muscle, that should help to give you relief of the lower back pain and or leg pain and sciatica. Now, if when you do the assessment, it's symmetrical side to side, it's not the piriformis syndrome, then we get more confident that it's a herniated disc. And so the exercise I'm going to give you should feel good. If it doesn't feel good, obviously you don't want to do it. But for a herniated disc, the discs herniate backwards, so we want to do things to try to push it forward. And so what that looks like is you're gonna lay on your stomach, and then you kind of want to keep your pelvis connected to the floor or the bench or whatever you're on, and then you're gonna lift up. And basically you want to go as high as you can that's comfortable, and then come back down. And then you'd go up and back down and up. Okay, going as high as what is comfortable. And basically what you do then is do 10 reps of that and do that 3 to 5 times per day. Okay, so this is an easy way to assess whether your lower back pain and sciatica is caused by a piriformis syndrome or a piriformis muscle, or if it's a herniated disc, and a couple things you can do to get relief. If you have any questions, feel free to call and come into the office. We can do an assessment and determine, what is the cause of your lower back pain and sciatica, and do treatment. I provide same-day appointments and same-day treatment Monday through Thursday, 8 a.m. to 6 p.m. I don't do any long-term treatment plans. The goal is to get you out of pain and out of the office in the fewest visits possible. That's how we approach it. So thanks for watching. This is Dr. Eric Lund, your Roseville neck and back pain relief chiropractor.